Education topic, we decided to look into why do people miss their yearly primary care visits. And for most people, it could be just not having an issue, so they decide it's okay, they can skip this year, and then they might roll into the next year, and so on. It also could be due to not having insurance to cover their visit, not having a way to get to their visit, not having a doctor they like enough to go and see. Or they just may be scared and nervous to see a doctor. It can be a scary time for most.
Program goals and objectives. Our overall goal is to increase the proportion of New Jersey adults who attend their annual primary care visits. Second is our process objective, which is by the end of the first 6 months, participating healthcare locations will collect program awareness surveys for at least 75% of patients who attended an annual checkup in that time. Third is our first impact objective, which is by the end of the first year, participants will be able to identify at least 3 behavioral risk factors for hypertension and detect them in their own behavior. Fourth is our second impact objective, which is by the end of the first year, participants will be familiar with the use of appointment scheduling software and have also educated at least one non-participant. And lastly is our outcome objective. So by the end of the first year, 90% of participants will have attended at least one primary care visit. Phase 1, recruitment. We will recruit at least 20 independent healthcare locations across New Jersey that do annual checkups. We'll use social media and local newsletters to connect our target audience to our website, and the website will have information about the program as well as online registration for the educational sessions. The second phase, education, is when we'll hold 3 education sessions informing our participants about the risk factors of hypertension. We'll teach them ways to overcome typical barriers to attending annual checkups like lack of technological fluency or health insurance, and we'll also encourage them to spread the awareness to other people in their lives. And the educators for these sessions will include peers of the target audience as well as primary care workers. And because our target audience mostly consists of adults with work and family responsibilities, we'll compensate everyone for each session with a small gift card, maybe $5 to $10. These education sessions will also use different educational methods in order to reach learners of different styles, so lectures and presentations for oral and visual learners, and role-playing sessions for kinesthetic learners. And during our last phase, review, each healthcare location will administer surveys to their patients, which will collect information on everyone's level of awareness about the program, their understanding of the importance of attending primary care visits and knowing their blood pressure status, and their intent to continue attending their annual checkups in the future.
For addressing goals and objectives. So for our program, for the process objective, this entails that having staff at the primary care clinics be trained on effective strategies for educating patients about the importance of yearly visits to prevent or manage hypertension. For our impact objectives, we have 2. So the first objective is that in order to support early detection and management of hypertension, we need to address behavioral barriers, which include a lack of awareness, low perceived need, and competing priorities. And then for our second impact objective, this includes having a focus on the increased access to and utilization of annual primary care visits among this population. And this includes reducing common barriers such as cost, transportation, and awareness over the 12-month period for our program, with the goal of improving early detection and management of hypertension. And then for the final, for our outcome objective, this entails by the end of the 12-month program, we need to have focusing on increasing the percentages of adults who attend their yearly care visits and hoping that that is increased by at least 20%, which leads to earlier detection and improved management of hypertension.
For our program, we'll be using multiple different recruitment methods. So first, with our participating healthcare clinics, we'll be distributing brochures and surveys in waiting rooms to recruit patients directly. We'll use targeted social media ads and posts for younger audiences, and then local newsletter ads to reach older demographics. We'll set up easy-to-use program websites for information and registration. We'll collaborate with faith-based organizations and community leaders to reach underserved populations. We'll send personalized invitations in the mail with educational materials about hypertension, and we'll also look to host booths at health fairs, community events, and offer things like free blood pressure screenings to engage more participants.
When it comes to process evaluation, we decided to look at the participants' attendance at each educational session by having them sign in as they arrive. Participants then would complete a brief online survey at the end of each session, which again we use to gauge their comprehension of the material. This survey asks questions about the material we talked about in the lesson, and it tracks their engagement with the educational approaches, and it's used to identify issues with our strategies early on. In order to reach our objectives, we must remain adaptable, align with our implementation with the needs of our target population, and carefully track the utility of the different recruitment and educational approaches we employ to support the development of future programs.
For our program's impact evaluation, we will employ both quantitative and qualitative data collection methods. To assess the behavioral objective, participants will complete a post-program survey to measure their understanding of the importance of regular health checkups, their intent to continue attending annual doctor visits, as well as their ability to identify at least 3 behavioral risk factors for hypertension and recognize them as they relate to their own habits. This directly aligns with the constructs of perceived susceptibility and cues to action within the health belief model by prompting participants to think critically about their health behaviors and connect them to potential health risks relating to hypertension. To evaluate the enabling objective, participants will complete a mock appointment scheduling practical assignment to demonstrate their competence with the appointment scheduling software. Participants will also be required to submit materials confirming that they taught at least one non-participant how to use the software, and this may include a written reflection, photos, or another form of documentation describing who they taught, what was covered, and any challenges they encountered in the process. This dual method approach that I described allows us to use quantitative and qualitative data to assess the participants' self-efficacy, knowledge application, and skill acquisition immediately after completing our 12-month educational program.
Outcome evaluation. Our method uses an end program survey to measure behavioral changes among the participants. This survey is designed to assess 3 key areas. First, participants' understanding of important health concepts such as the importance of regular checkups. Second, their intent to continue attending annual doctor visit. And the third, their ability to connect risk factor with their own health habits. This evaluation is effective because it directly measures whether we have met our program objectives. It also accesses both knowledge and intent to change, which are central to the health belief model, a widely used framework for understanding and predicting health behaviors. Finally, the survey allows us to track trend in behavioral change using quantitative data and giving us a clear picture of program's impact. In summary, this outcome evaluation helps us to understand if our program is making a meaningful difference in the participants' health behavior and intentions. Thank you.